Dear all, I'm Dr. Norman Connors, MD, the head of the Department Neurology at National Institution of Neurological Research. Today, I would like to share with everyone the most comprehensive overview as well as the treatment method for common condition nowadays manifested by disorders such as dizziness, sleep disorders, headaches, tension, depression, collectively known as cerebral circulation insufficiency. Ladies and gentlemen, cerebral circulation insufficiency is a term used to describe a pathological condition with many different symptoms, but with a common underlying mechanism of brain malnourishment due to the blood deficiency, leading to a decrease in oxygen and nutrient supply to the brain cells, causing them to lack energy to function. The disease is common in middle-aged and elderly people, especially mentally engaged workers, and affects more men than women. However, nowadays, cerebral circulation insufficiency tends to rejuvenate. According to National Institute Biological Technology Information of the United States, up to 50% of elderly often complain about sleep disorders, where many elderly people can only sleep for 4 hours per night and even less. And the incidence of insomnia in the elderly is often higher than of adolescents. The main causes of cerebral circulation impairment are high blood pressure, which causes arteriosclerosis. General circulation disorders include low blood pressure, cardiovascular disease, congenital arterial abnormality, thrombotic inflammation, trauma due to the impact of injuries, herniated discs in the cervical spine, cervical spondylosis, which compress blood vessels due to various disease, brain tumors, nerve root tumors, and other neurological disorders. In addition, modern life is busy, causing more and more young to suffer from cerebral circulation disorders, with risk factors including mental labor stress, pressure related to economics and family, imbalanced diet, inadequate intake of nutrients, or excessive consumption of processed foods, canned foods containing lots of sugar, sweeteners, and fried oils. Lack of exercise leads to sluggish circulatory system and poor blood circulation, prolonged stress, and serious psychological trauma. Symptoms of people with cerebral circulation insufficiency include frequent headaches. This is the most common and earliest symptoms, accounting for about 90%. The pain is crampy or localized in the neck and forehead area. Dizziness, feeling unsteady, walking or standing, changing position or feeling lightheaded as if seasick. Eye flutter, vision lost, especially when transitioning from lying down to sitting or standing abruptly. Sensory abnormalities. Patients feel abnormal sensations such as hearing the sound of mice, insomnia, poor sleep, attention deficit, decreased attention span, or absent mindedness. Emotional disorders, easily irritable or emotional, memory impairment. Ladies and gentlemen, whether it is acute or chronic insomnia, it can have significant impact on the health and daily life of patients, especially prolonged insomnia can lead to fatigue, lethargy, and constant state of drowsiness and lack of alertness. The immune system of those who do not get enough frequent experience insomnia can be much weaker than that of average person. Lack of sleep can also increase the risk of heart rhythm disorders, high blood pressure, coronary artery disease, stroke, and even death. Insufficient sleep can also increase the risk of cancer. The patient with cerebral anemia and cerebral circulatory disorders is susceptible to stroke when a blood clot forms inside the brain tissue, and cerebral arteries or stroke may occur and brain cells may not receive sufficient blood, causing serious impact on the body's activities and functions. Severe stroke can lead to complete loss of consciousness and communication, and even immediate death. Alternatively, when blood to the brain is insufficient, cerebral arteries may rupture due to weakened walls, leading to bleeding or brain hemorrhage. At this point, brain function is affected, and if not treated timely, the patient may die immediately. Cerebral insufficiency is not an incurable disease, so it can be still treated if the right method is chosen. 1. A treatment of cerebral circulatory insufficiency with Western medicine. The advantage of Western medicine is that it helps to improve symptoms quickly, but if used for a long time, it is difficult to avoid the risk of side effects and the drug dependence. Therefore, treating cerebral circulatory insufficiency needs a safer and more effective long-term solution. Medicines treat circulatory insufficiency need to balance their benefits and the risks. 2. Treating circulation deficiency with herbal remedies. Cerebral circulatory deficiency is often prone to recurrence, so besides improving symptoms, it is necessary to combine blood circulation and brain nutrition to improve blood circulation and enhance brain function. Along with Western medicine therapy, nervous system experts usually recommend using natural herbal remedies to ensure safety and maintaining long-lasting effectiveness. To ensure that our brains always have enough energy, we should maintain 7 hours of sleep per day. This product in my hand is the Vikamax herbal products. To enhance the blood pressure circulation in the brain, we cannot ignore this standard Vikamax product. This is a 100% natural herbal products, all of which are rare herbal ingredients. In the brain medicine, especially specializing in symptoms such as headaches, dizziness, insomnia, tension, and depression. Therefore, Vikamax is an extremely safe product for health and has no harm effects when used. With such ingredients, it helps to increase blood circulation, enhance blood circulations in the brain, and increase blood flow to the brain, especially to enhance the process of metabolism exchange between blood and brain cells, which is extremely beneficial for patients with cerebral circulation disorders, as well as patients with vestibular balance disorder. A few other medicinal ingredients in Vikamax have the effects of nurturing vital energy, nourishing blood, nourishing the kidneys, calming the mind, regulating menstruation, helping to relax the mind, and encouraging patients who have been suffering from insomnia for a long time to fall into a deeper sleep. Through research, the product has been shown to reduce the condition of arteriosclerosis, decrease cholesterol, reduce the occurrence of blockaged blood vessels, as well as reduce aggression of red blood cells. Vikamax is really a great product for patients with a specific cerebral circulatory insufficiency, such as vestibular disorders, long-term insomnia, and patients with related diseases. In terms of usage, Vikamax is formulated capsules form. We should take it twice or 3 times a day, depending on the state of our health, with each serving consisting of 2 capsules. It's best to take capsules 30 minutes to 1 hour after meals. Patients only need to use it regularly for the first 15 days to see improvements in the symptoms such as blurred vision, dizziness, headache, and difficulty sleeping. Continuous use for approximately 30 days can result in a 70% improvement in conditions such as cerebral anemia and insomnia. And by maintaining a continuous use for about 60 days, all pathologies such as insomnia, vestibular disorders, cerebral anemia, and cerebral circulation disorder almost completely disappear. without the chances of relapse. Ladies and gentlemen, above is all the information about cerebral circulatory insufficiency and the herbal products Vikamax that I have shared to help you make a better choice. Anyone with vestibular disorder, edema to the brain, insomnia, and poor sleep, use this Vikamax herbal products immediately. Currently, the product is also having a very good promotion for everyone. May you always be filled with health, happiness, and peace of mind.